room, there are about 8 men, which means that 1 will be diagnosed with prostate cancer. And we know that 15% of patients go on to develop incurable metastatic disease. This means that the cancer spreads from the prostate throughout the body and specifically to the bone. Prostate cancer bone metastasis causes severe chronic pain, an increased risk of fracture, and even paralysis. The bone goes from what you see at the top, the control bone, to what you see at the bottom, with the irregular, disorganized bone being laid down in those void spaces. But why does this happen? And why does it make the bone weaker? Well, I believe it has everything to do with the cellular network that lives inside of your bones. Osteocytes, or bone cells, reside in lacunae. You can literally think of this as the house for the cell. And they have roads and tunnels that come off of it, called canaliculi. Lacunae are shown in yellow at the top and purple at the bottom, and canaliculi blue at the top and green at the bottom. This lacunocanalicular network allows for your cells to sense mechanical stimulation. When I take this step, they know which way is up, and it allows them to communicate with other osteocytes and bone cells on the surface of the bone to reorganize the bone, remodeling it to give it optimal structure and strength. I think that this process is disrupted in prostate cancer bone metastasis. So how did I test it? Well, I went all the way to France, and I took the highest resolution images of this type of bone to date. I used an imaging technique called synchrotron nano CT. You can think of this as going to the doctor for a CT, but on a very small scale. I then developed an artificial intelligence algorithm to identify those lacunae, yellow at the top, purple at the bottom, and canaliculi, blue at the top, and green at the bottom. And what I found was a highly organized network in that control bone. You can see lacunae in one direction, canaliculi coming off in the other, reaching to the surface of the bone to get nutrients and communicate with their cells. However, in a prostate cancer-associated bone, I don't see this. I see way more of those purple lacunae. I see wispy, disconnected canaliculi with no organization to them. And when I take a step, this tells me that there's no mechanical stimulation being given to those cells. They don't know which way is up anymore. And they can't talk to other osteocytes. And they can't talk to those bone cells on the surface. Therefore, the cells literally cannot talk anymore. This implicates the lacunocanalicular network in that irregular bone remodeling, because it's not getting the right input to restructure the bone to give it optimal strength and structure, leading to increased risk of fracture. With this research, I hope that we can develop strategies that will treat